Hi friends, welcome to today's video is on incident reporting. We'll see what is the incident reporting and how it will help in the healthcare facility and how it will help the healthcare staff. Let us start our video. Before starting, I just want to tell you that what is incident. So incident, let us see that in a layman language what is incident. Okay. So in our daily living lives, day to day, in our home, in our home we have the siblings, right? When siblings are fighting and anyone get hurt, to whom they are complaining? They are complaining to their parents, but there is not a process of reporting or anything, but still we are reporting it. And if anyone has got hurt or anything, then the preventive actions will be taken, corrective actions will be taken by the parents, right? But if in the public area anything is happening, then it is going to the police station. Police will take care the further requirements, right? Similarly, in the hospital, if anything is happening, like any untoward harm to any patient, staff, visitor, or anyone, that is the incident. So what is incident? An incident is a, it can be anything which will be result in any harm or has the potential to do the harm to a patient, staff, or visitor. It may the having the tendency, or it is like unintended, unexpected harm, loss, or damage to the patient, staff, or the visitor. What is the importance of incident reporting? Incident reporting is important because it will enhance your workplace safety. If you will report today the incident, then tomorrow it may be corrected and prevented to happen the same incident further. It leads to legal and compliance benefit. Wherever the requirement of the legal requirement, we can produce it. This has incident has been raised for this and we have taken this action and all. Okay. And it will help in the decision making. If the incident will be raised, it will be noted, then only the decision can be made perfectly on the base of the incident. When any staff is keep on complaining on the other staff, or any HOD needs to be taken the decision on the staffs, or organization have to take the decision, then that time incident reports only will help. uh, and if any equipment is getting continuous breakdown, then to replace the equipment, the incident reports is required for the management. How many times it has got breakdown, where is the reports, corrective action, preventive action, what has done by the management and all. So promotion of the culture of transparency, also promoting to promote the culture of transparency, incident is required. Types of incident, there are four types of incident: near miss, no harm, adverse, and sentinel. Let us see one by one. Near miss. Near miss is the thing that it is about to happen, not happened. Like the you are walking in the corridor, there are water, you are about to fall, but someone has catched you where you are not fall down, so you are safe. But that also should be reported, because if any other person will pass and no one is there to catch, then definitely the person will fall down and will get the adverse event or sentinel event. So to prevent that, always the near miss required to be reported. Any near miss needs to be reported. Near miss occurs 300 times more than the adverse event. Each and every day near misses are happening, right? If we will report the near miss, then we can prevent the adverse event, sentinel event, and all. Okay. If we are not reporting the near miss, that only will convert into the adverse and sentinel event, that will increase the count of adverse and sentinel event. No harm, that you have already faced the incident but you are totally fine, there is no harm, like you have fell down but you are totally fine, nothing has happened to you, no adverse, no sentinel, nothing, you are totally fine, then that is called as a no harm event. Okay. But no harm sometimes can result to an adverse event. What is adverse event? Any temporary damage or temporary harm, minor, has happened, like it can be curable within 7 days, then it is a adverse event. But the major is the sentinel event. What is sentinel event? Any unexpected incident, result, death of the patient, visitor, or staff, or any major loss of function for the healthcare workers or the patient or the visitors. Okay, so it may be the medication error, it may be the wrong surgery, it may be the wrong site, it may be the delay in treatment, it may be due to fall, it may be due to restraint, it may be due to suicidal case, it may be due to rape, it may be due to wrong treatment. Okay, so let us see some example of sentinel events to clarify more about sentinel event, because it is more important. Any infant abduction or discharge to the wrong family. Any infant abduction, any newborn baby, or any kids or any patient, if abducted by any other outside person, that is a sentinel event. Any infant has discharged to the wrong family, the family parents has not been checked and it has been discharged to the wrong family, that is also a sentinel event. Any unexpected death of a full term infant, unexpected death, like patient has reached to the emergency and labor room, that time patient was totally fine, baby was fine, but during delivery, because of any process deficiency, the full term infant has got death, that is a sentinel event. Any wrong site, wrong surgery, so patient A is patient A is admitted for the surgery, but the patient B has been shifted for the surgery, and no one has done the patient identification and surgery has done. When the patient has came out, it has found that the patient was not for surgery, that is a sentinel event. Any surgical instrument has left inside the body due to count failure of the surgical instrument during the OT, then also it is a sentinel event. Any rape, any suicide in the hospital is a sentinel event. Any medication error which leads to the patient death, or patient got paralyzed, patient is in coma because of the medication error, it is a sentinel event. Any fall from the cot or stretcher leads to the hip replacement, joint replacement, or any surgery on the leg, hand, or any brain stroke, then it is a sentinel event. Radiation therapy to the wrong body region or anything, then it is a sentinel event. Hemolytic transfusion reaction due to blood group incompatibility is a sentinel event. Blood group A needs to be transfused to the patient, you have transfused the other patient blood without cross verifying, without doing the identification properly, then it is a sentinel event. So any injury to the patient, staff, visitor, anyone, it needs to be reported, and it will be considered as a sentinel event. It is not like only to the staff, only to the patient, if anything will happen it will consider as a sentinel event and it should be reported. Any incident will happen to anyone, staff, patient, visitors, that needs to be reported. It's not only for the patient or the visitors, right? Staff also is equally important. Who is responsible to raise the incident? All employees are required to report the incident to their supervisors immediately. Okay, all employees, like from the top to bottom. Okay, from the CO label to the housekeeping label, you have to report the incident. Everyone is having rights to raise the incident, and to whom to report. The incident needs to be reported to your shift in charge or head of the department. If no one is there, then quality department or medical admin or your operational admin you can report. To the top management also you can report the incident. How to report? Through the incident reporting form. All the incident needs to be reported within 24 hours of the incident. happened, but sentinel event needs to be reported immediately and it should be analyzed within 24 hours. The corrective action, preventive action should be implemented within 7 working days. Clear? The sentinel event to be implement a sentinel event to be corrected and prevented. A preventive action needs to be taken care within 7 days. It should be reported immediately, should be analyzed within 24 hours. Other incidents, yes, the time is there, you can report within 24 hours. This is the incident reporting format. This is the date and time of occurrence needs to be entered. Date and type of reporting also is important to be entered, because to find out when it has happened, when it is reported, this is the important thing in the NABH. Okay, you can implement the incident report form in the hard copy, or nowadays the software is also available in the market, can go for the software also for the timely reporting of the incident report. Then who has reported, who is the affected party, what is the classification of the incident, it is mentioned here. Near miss is any error that did not reach to the individual. Any error reached the individual but did not cause the harm, that is no harm. Adverse event is the thing where the harm, it has caused the harm but it lasts less than 2 weeks. Sentinel event, it is like more than 2 weeks, or permanent, or any intervention, whichever is satisfy your classification, you can just tick on that. So here some nature of incident has been given. Fall, any patient, staff or visitor fall. Administrative related, like any billing error, any order entry is wrong, any missing of the medical records. Then doctors related, doctor has not visited to the patient, second opinion not been facilitated, delay in the doctor's visit. Anything doctors related also is equally important to raise the incident. Lab related, incorrect labeling, incorrect sampling, delay in reporting, sample lost, incorrect report, reporting errors, anything that needs to be raised the incident. Radiology related, same, delay in reporting, any wrong patient, any IV contrast reactions, any contrast extravasation, anything needs to be reported. Equipment related, any equipment breakdown, any accessory missing, any damage during the transfer from one unit to another unit, or during the use, that also needs to be raised the incident. Any security related, like any assault or any theft, loss, absconding of the patient, also needs to be raised the incident. Any clinical care related, any bed sore, any fall, any incomplete, incorrect documentation, any orders has not been followed by the staff, needle stick injury, injury to the patient, transfusion reactions, any hazardous chemical material has splashed out to the eyes, or you have got the bloody fluid exposure, any SSI, COTI, uh, any urinary tract infection, any surgical site infection, any ventilator associated pneumonia, catheter bloodstream associated infections. So these are all needs to be reported to as a terms of in the incident reporting form, and it needs to be reported to the quality department. Okay, any delay in the OPD billing area, any delay in the treatment, any departmental delay needs to be reported. Any facility related, like UPS breakdown, lift breakdown, generator breakdown, also needs to be reported. Any surgery related, PSC not done, any surgical site marking has not done, that also needs to be reported. Then you can write here the incident in details. Incident always needs to be reported in detail. What happened, when happened, how it has happened, and who has done it. Major thing is the timings. Note the timings when it is happened, when you have identified, when you have reported it. Okay. Then next, root cause analysis. Find out the process failure, the manpower failure, or the mission related, or the communication related, or any specific details uh, of the root cause. Always the root cause, do it in the 5 why. NABH ask 5 why tool most of the incidents. There are many tools for the root cause analysis. You can go the do the Fishbone diagram, you can do the 5 why, you can do the Pareto. So the quality tools, any quality tools you can use to do the root cause analysis. But for the easy, you can go for the 5 why. 5 why is that why. Ask 5 times why, then you will get your answer. So that will be easy to do the root cause analysis for your any incident. But some incident, yes, it is where the incidents are occurring continuously, then go for the Fishbone diagram, why it is happening. Then in the medication errors, do the Pareto, you 80-20 rules. You will find out what is happening, why it is happening, and the root cause you can get it. If you will not do the proper root cause, then your corrective action will not be proper, your preventive action will not be proper. Corrective action, preventive action always depend upon the root cause analysis. If the root cause analysis is properly done, then only your corrective action also you can do it, and preventive action also you can do it. Then any other specific you can just enter here. The major part is your signature part. Whoever RCA kappa done, they have to sign here. Then the all incidents should be reviewed by quality. Then it should be reviewed by management. Okay, because all incident needs to be reviewed by management. This is the requirement of NABH. So root cause analysis, what happened, why happened, how happened, what can be done to prevent again. It is the requirement of your root cause analysis. Define the problem, collect the data, identify the possible factors associated with the problem, then identify the root cause, then recommend your corrective action. This is the way to do the root cause analysis. Use the quality tools available. As I told you, 5 why, Fishbone, and your Pareto, most common tools you can use to do the root cause analysis. Corrective action is what? Corrective action is the, you can correct for the timing. Corrective action and preventive action are not similar. Corrective action for the time being, to rectify the process, to correct the process, is the corrective action needs to be done. And once corrective action done, do the monitor and follow up it. That is the corrective action. But when it is come to preventive action, it should be eliminate the cause. To eliminate the cause, the preventive action is required, right? So corrective action and preventive action are two different things. Correction is the immediate fix. Corrective action eliminate the root cause. Preventive action prevent proactiveness. It should not happen again in future. That is your preventive action. Okay, this is all about today's incident reporting. Thank you so much. If any doubt or anything, you can just comment in the comment box. If you like the video, then please do the subscribe of my channel for more upcoming videos on quality in healthcare. Thank you.